Good afternoon, everyone. It's Dr. Gershon with another Endeavor Better Health webinar. I am absolutely thrilled to be here today with really one of the leading physicians and CEOs in the New York area, Dr. David Berger. Dr. Berger has an outstanding background both as a physician and as an administrator and as a business savvy fixer of healthcare problems in large hospital ecosystems. But before I bring Dr. Berger on, as I always do, I want to thank everyone for a tremendous 2023. We now have just under 2 million views, a platform that really rests on a notion that collaboration and partnership and networking builds relationships that are needed to solve complex problems in a very difficult healthcare environment, especially with the big problems that we have in the macroeconomic backdrop. Liquidity, human resources are all issues that large enterprises and large hospitals have to deal with. Within this framework, Endeavor is dedicated to building companies that make a difference. For us, that means understanding what the problems are of large hospitals like Dr. Berger's hospital at SUNY Downstate, like large enterprises like Microsoft, Apple, Amazon, Google, NVIDIA, coming in with an open mind as an investor, as an entrepreneur, as a founder, to be able to say, what can we do to bring our innovation into the fold of your enterprise to solve real world problems? So today is a very practical discussion with Dr. Berger. He's going to tell us a little bit about his background, but more importantly, he's going to tell us about his predictions for 2024. What do hospitals need to help patients have better outcomes? What do hospitals need in order to survive in a difficult macroeconomic environment? Dr. Berger also has a unique position of being part of a New York-centric hospital system that is in an underserved area within the state and does represent a very diverse community. This is important because the funding for the hospital is a critical issue. And perhaps we can talk a little bit today about how technology can address some of the problems to create a more efficient and effective healthcare system. This would include things like human resources. It would include things like record keeping. It would include things like imaging, diagnoses, and treatment algorithms. So without any further ado, I want to introduce a real leader in the New York area and in the hospital system at large across the country, Dr. David Berger. David, it's a real pleasure to have you on today. I know that we've interacted with a number of really exciting things with early stage companies through our TechStars collaboration. You've gained some insight about some of the innovation, particularly in AI. You have your finger on the pulse of many things through conferences and personal relationships. I'd like you to tell us a little bit about your background, very much in brief, but then really focus in on things I talked about earlier, which is, what do you see as a leader in a major hospital as important changes that you potentially are going to bring to the hospital setting in 2024, 2025? What is it that CEO, founder, entrepreneurs of emerging companies need to understand to make this an effective relationship, to bring to you solutions? So I'll turn the floor over to you.
So Martin, thanks a lot for having me. It's really a pleasure to be on this podcast with you. What you've done with Endeavor and this podcast and growing it is nothing short of phenomenal. So thank you for inviting me to be on today. So briefly, I'm a surgical oncologist by training, did my surgical oncology at MD Anderson, started out as an academic physician very early on. I had the opportunity to go into a management and leadership position. And by leading academic health centers, I saw very early on, back in probably 2007, the benefit of digital health, especially telehealth, and really got my feet wet through implementing different telehealth solutions for a large geographic area in the Southwest. From there, got very involved in the innovation space through the TMC X Innovation Center, and now serve on several advisory boards of startup companies and I'm involved with several digital innovation spaces as well. So really believe that digital and now AI is going to revolutionize how we provide medical care. I think healthcare is way behind most other industries in terms of digital adoption. And I think now with AI and what's happened with GPT-4 and all the new large language models over the past year, you're going to see an acceleration of the adoption of digital solutions, especially generative AI in healthcare. So the challenges in 2024 are probably the same as the challenges in 2023. The main thing is the issue of workforce. There's shortage in workforce in terms of physicians, nurses, technicians across the board in healthcare, and that's not going away very quickly. And then there's the financial pressures in terms of trying to make a margin. Most hospitals, especially nonprofit hospitals, make very narrow margins, if any. And with the inflation of almost 20% over the past 3 years, there is definitely a struggle to make ends meet in healthcare. So really figuring out the financial side as well as how we're going to deal with our workforce shortages. So because of those two main issues, I think the industry is ripe for disruption, and digital health tools are going to be the driver of disruption within healthcare. The other things I think that we'll see more in 2024 because of workforce as well as financial issues are the issues around further consolidation in the industry. I think small players are going to continue to try to join networks in order to be much more effective. And then I think there's going to be more of a drive towards value-based care, away from fee-for-service. And I also think there's going to be a huge emphasis on dealing with social determinants of health. So I think those 5 things are the main drivers and the main things we're going to see influencing what happens in healthcare this year. So just to go over what I said, workforce, financial pressures, consolidation in the industry, development of more value-based care models, and focusing on social determinants of health issues.
Fantastic overview, as expected, frankly. Let's get a little more granular. So let's take first human resources, physician, nurses, primarily. Let's start at that in that swim lane. And let's talk a little bit about Microsoft. With a $20 billion investment in Nuance, clearly they represent a formidable force. Now, they represent currently between 7 and 9% of the global electronic healthcare market. They now have a new partnership and collaboration with Epic. Talk to me about your perspective within a hospital system that is constrained financially. How do you look at large players like Microsoft and the potential integration of Nuance into a hospital nursing patient environment?
So I think one of the biggest advances in generative AI in terms of unburdening a workforce and decreasing the issue of burnout amongst our providers is the issue of ambient dictation. And that's where Nuance comes in. So Nuance is currently the leader in the field of ambient dictation. And it's obvious why Epic joined Microsoft and Microsoft purchased Nuance, because that's going to be a big point of entry into how we look at electronic health records in the future. And what I mean by ambient dictation is physicians, nurses, other providers being able to turn on the computer, engage in the conversation with the patient, and then using generative AI like Nuance, be able to generate the patient note directly from that conversation between the physician or the nurse, the provider, and the patient. So that currently providers spend about 50% of their time sitting at a keyboard entering information into the electronic medical record. By using ambient dictation, we will free up a significant amount of clinician and provider time, allowing workforce to do other things, especially dealing directly with the patient. So I think it's going to revolutionize the patient encounter. It's going to revolutionize how providers interact with the electronic health record. And I think it's going to be a major breakthrough in terms of reducing burnout, as well as improving provider satisfaction.
No, that's again a terrific point. Let me add a couple of points, from my perspective. So one of the key use cases for this type of technology is improved productivity, which of course goes to one of the critical issues of the cost of healthcare, which is the scarcity of human resources. So, as a patient, as a physician, I am in hospital settings. I do see how hospitals run. If they were formulated in a way that a small business or even a medium-sized business were structured, you wouldn't walk into a waiting room and see 6 people behind the computers doing clerical work and 3 patients. You wouldn't see 30 rooms, most of which are empty except for specific hours of the day. So there is this very interesting dichotomy between the burdens that are on healthcare providers and the inefficiencies within the healthcare system. So the first question is, another use case for some of this technology may in fact be repurposing a certain percentage of employees to other jobs. There's really no need to have so many people looking at so many clerical things, particularly when those clerical issues are often done incorrectly. So there's billing problems that patients become dissatisfied with, and hospitals lose money in terms of collection problems. There's medical records which often are lost or misplaced because most large hospital facilities have multiple offices, and often those offices don't talk to each other. So how do you see the consolidation? And I'm speaking a bit about real world practical things, because this is a practical conversation, to be able to catalyze a conversation with early stage entrepreneurs in this environment where you say, you know what, I have 4 satellite offices. Can we do a project in one of these offices to prove, your market viability, or to prove your use case, to look at some of these issues about consolidating, workers, or consolidating, inefficiencies? What's your thinking about that from a real world perspective? How does this jive with what your capabilities are?
So the way I look at how we deliver healthcare, I put it into 3 buckets. So there's the back office things that are coding, the billing, those kind of functions, revenue cycle, supply chain, those issues. Then there's the front office issues in terms of scheduling, getting patients in, reaching out, dealing with physicians, all of those issues. And then there's the middle, which is providing care. So I think when I look at different solutions and how to implement them, the providing care piece is probably the most complicated to do and takes the most effort from entrepreneurs. But the way they need to approach it is they need to be able to identify a big problem in healthcare, have a really strong business model, and figure out how they're going to help me implement. They can't put the burden of implementation on the hospital because, as we've already discussed, the hospital is stressed with the number of people that we have available and the current tools. So if they're going to bring something to the table that's going to solve one of our big problems, they also have to have a pathway for implementation, as well as a pathway for a reasonable business model. What I'd like to see from most relatively early stage companies is that they're willing to share risk with me. That it's not completely on me, the cost of the solution. I would recommend that they don't do free pilots. I think that you end up with spending a lot of resources on the startup side that may or may not lead to a sale. If you're doing cost-free pilots, you need to have some business model where the institution does have skin in the game, but there's a shared risk and a shared benefit to that project. And I give you the example of one project we're currently doing is we've have a problem with our patients getting readmitted to the hospital and also filling out their patient satisfaction surveys. What we initially did was we had 2 nurse practitioners calling patients post-discharge to make sure they got their medications, they had their appointments with for follow-up, and all the things they needed to be successful at home. Well, we found out by trying to call patients, we only reached about 40% of the patients. And that I was wasting $300,000 worth of nursing time, because nurse practitioners are well-trained and are very well compensated. So we started to look at digital solutions and generative AI solutions to make these calls. And instead of using phone calls, using SMS and chatbots, but backing up the chatbots with the option of having a live person when things got too complicated. And we were able to save over $300,000 in people time by implementing that chatbot. On the back end, we're in the process of looking at revenue cycle companies that are able to use AI to look at the chart and generate claims and the bills based on what's in the chart, and therefore take out a huge number of people who are not necessary to going back and forth over the charts. One of the downsides of that, we know that the insurance companies are also employing AI to look at, because they still want to be able to deny claims. So there's sort of the fear of a war evolving between the insurance companies' AI and the providers' AI to try to optimize the payment or the lack of payment. But that's sort of how I look at it: is are they solving a big problem? What's the team? Do they have an implementation strategy? And what's the business model that they're employing, and are they going to share risk with us?
That's great. A couple of follow-up questions here, because we have 2 really good use cases here, and you've laid it out very, perfectly: front office, back office, and the middle section. Certainly the electronic healthcare record piece of the physician, nurse, patient interaction, is what Nuance is clearly targeting. An extension of that is an opportunity for some of these young entrepreneurs, because it's going to be hard to compete with Nuance. It certainly could be the case that you can be accretive if you find a particular niche or you find a particular solution. But again, I'm looking at ways for early stage companies to be able to come to you and say, Dr. Berger, we have a team that can execute. We have data from projects that we've worked on which prove our commercial validity. We have a leader in the CEO, entrepreneur, founder who, Endeavor helps coach, to be able to put together a skill set that matches their claims. This is often a big problem. It's often a disconnect that has frankly occurred over the past 20 years, which is, here's the vision, here are the eyeballs, to use a term from the 1990s. Let's fund it and see what happens. That no longer flies and will no longer fly. So what you're saying really resonates with me, which is, how do we put together leadership training for CEO, entrepreneur, founders who understand that it's critical to put a team together that can execute? And then the other piece is, how do these leaders find people like yourself or other people in large industry or large enterprise or large hospital systems to convince them that they are worth a shot? And I love what you say about, both parties have to have skin in the game. And I will just say, from our perspective at Endeavor, we help finance these projects. So we believe that our skin in the game, alongside the entrepreneur founder and enterprise and hospital, it's a three-part solution, if you will. We think that finding the right partner like yourself is everything. Someone who knows what to do when success is in sight. Knowing how to amplify a successful interaction, a partnership, is something that, frankly, some industries have had problems with over the past. For various political reasons or business reasons, they often take a project that's successful and they question whether or not this is worth scaling it, or should it be buried. So I'd like to shift to a little bit deeper kind of granular level about what is the implementation, assuming that you have over the next several years integration of some of the large players like Nuance into the healthcare system to solve some of the human resource problems, and you have a slew of entrepreneurs coming to you. How do you pick and choose within this framework? Where do you start? What's the door opener?
So I think the most important thing is network. And that's why I think accelerators like Techstars, companies like Endeavor are so critical. Because the way I get introduced to companies is through my network. And if someone in my ecosystem sees something that's interesting, they will then send it to me and make the introduction, and then I'll take a quick look at things. So I think one is you need to build a strong advisory board, and you have to participate in the innovation ecosystem. And whether you do it with Endeavor, you do it with anyone else, it's really important to be part of the system. And I've seen some entrepreneurs say, well, I'm further along. I don't need to be in an accelerator. I don't need to do. I think it's really key to be part of the ecosystem to build that network. And now there are so many digital health meetings run by some of the big names that it's really important to participate in the meetings, to try to present at those meetings. I think that is a key to being seen. And that's how I identify companies. I rarely will take a cold call and say, yeah, I want to see what you're doing, unless someone I know is saying, this looks interesting. David, what do you think about it? So network is really, really important in trying to get to my level. The other thing that I think that's important for me in trying out anything or demoing something is I need to have, if it's a clinical solution, I need to have a clinician who's passionate about the solution. Because I'm not going to spend all my time with the solution. If I see something, yeah, that looks good to me, I'll try to identify someone who may be interested. If they're not interested and there's not a clinician in my institution interested, I'm going to pass. On the back office things, if my CFO isn't interested or someone in finance isn't interested, then it's a non-starter. And then on the front end, if my VP of access isn't interested, it's really a non-starter. So in my institution, I'm the front door, but there needs to be other people within my hospital and health system that have a specific interest if we're going to be able to move it forward. So I've seen a lot of great things, but I can't manage all of them. So I need to have other people within the institution who are passionate about it.
Such an important message. I want to just underscore that, with big and bold underscore. It's not the case that, your vision as an entrepreneur founder, that you have the solution, that you have the innovation that is going to be a game changer, means that you are going to be successful. That is not the secret sauce. The secret sauce is knowing that there's a lot of people out there with really interesting innovation and technology who are all of the mindset that they can really change the world. The real practical turn of the key here is exactly what you said. Having somebody who can support your vision, somebody who is a champion, who will be able to make that vision operationally functional. Because to be able to take innovation, bring it into a large hospital or to a large enterprise means that you have to deal with political issues. You have to deal with resource allocation issues. You have to deal with timing and budget constraints. You have to deal with real people issues. So that's where the networking and partnering also takes an important role. And I do believe, as you said, conferences and other settings where people come together with a shared, I think, vision to be able to discover is very, very important. It is time consuming. It is physically challenging. It can be costly, but I do think it is an important part of actually providing a template for success. And I think that SUNY Downstate is really at the forefront of being able to provide important healthcare for an important part of the population in New York. And I know that it has significant support from the city and from the state. I would say, as part of this process, how do you see on a very kind of specific SUNY level, how do you see that interaction if young entrepreneurs have a particular idea? Are there grant programs within New York that you might be able to, perhaps offline to me and I can pass it on to them, or now, in a public forum, talk about the assistance that some young companies might be able to get in this environment that you're in control over?
Yeah, so the first thing to remember for any young company is look to see if you're eligible for SBIR, Small Business Innovation Grants from the NIH. And if you are, you need to have a partner in academics. So you need to have a university that is your partner, and then several companies have gotten millions from the NIH to develop their solutions. And what's great about the NIH is they don't take any piece of your company, right? They're not asking for any of that. So that's the first thing. The other thing in New York State, and actually from the federal government, are things called opportunity zones. And opportunity zones are places that provide tax-free and subsidized funds to allow small companies to grow. So most opportunity zones are socioeconomically disadvantaged places. And then New York State has grants for innovation. And downstate itself, we have an innovation center and very, very low rents for companies. Almost total rent for the year is $5,000 to $6,000 for a significant amount of space. So it's really, there's a lot out there, but I would start with things like SBIR, STTRs, which are NIH grants, which can provide millions of dollars in support.
Great. So last question, we're at the bottom of the half hour here. It's been a tremendously dynamic conversation. Take your crystal ball out. It is the beginning of 2024. Take us through what you see as, let's say, a 5-year vision that you look to as, reasonable probability of implementing some type of technology transfer into the hospital over a five-year period.
I think in 5 years, the electronic health record will be totally different than it is now. And it won't require people to be sitting at a computer all day entering information. So one is the electronic record in Epic, Cerner, and the others will be totally different than it is today. Secondly, AI and generative AI will have a huge part in supporting clinical care. It will not be replacing physicians, but it will be enhancing physicians' ability to make the correct diagnoses. And I think in the short term, probably 3 to 5 years, you'll see it widespread in radiology, in pathology, and in the emergency department. I think the other thing we'll see in 5 years is a change from straight fee for service to value-based care. And what will facilitate that is a lot of providers becoming also payers. So the institutions and the healthcare organizations that will be most successful are those that become payers and providers. And that's why you're seeing many of the big insurers like United Healthcare acquiring physician practices. Because not only do they want to be the payer, they want to provide the care and be able to save a significant amount of money by doing that and then enhancing their profits. And then the other thing, I think we're going to have a real focus on trying to deal with social determinants of health and acknowledging that social issues have a huge impact on the care of a population. And what I mean by that are things like transportation, employment, housing, diet. And you will see more and more attention by the federal government and the federal payers on trying to address those issues. I'll stop there. Those are...
No, that's fantastic. I can already say without any doubt, I would love to have you back in 6 months and see how some of the mid-year predictions are unfolding. It's, this is just the tip of the iceberg to really whet people's appetites. I think I'm in complete agreement with you that, the world will be completely different in healthcare in 5 years. And for me, the strong focus is how can we work together within large hospital systems, with physician practices, with large enterprises to bring some incredible early stage innovation into a practical, workable environment. Yeah. And I think, speaking to people like yourself or people from large organizations like Microsoft, who will be coming on the webinar in a couple of weeks, provide insights and hope and a real practical roadmap.
I think, just to conclude, for the entrepreneurs out there, healthcare is 20% of the U.S. economy. A third of that is estimated to be waste. So there's huge opportunity in healthcare. And I think as a healthcare provider, it's actually a really exciting time to be in healthcare. And yes, there's burnout, there's all kinds of issues, but there is no more exciting industry in this country, and that's going to change more in the next 5 years, I think, than healthcare.
Completely agree. I've never been more excited about being an investor, an advisor, and involved with early stage companies in my life. I think the science, medicine, technology, and the real need-driven forces here are extraordinary opportunities to make a better world. And at the end of the day, that's going to create just a momentum that more and more entrepreneurs want to go into healthcare, see the incredible opportunities, more investors will. This is a virtuous cycle that I'm excited to be part of. And I'm just absolutely thrilled about this, hopefully first of many webinars with you, David. Thank you so much for your time, your thoughts, your insights today. It's been a pleasure.
Yep. Thanks for having me.
Take care. Stay on for a second. I'm just going to disconnect us.
Sure.
I want to thank everyone. I will see you next week. We have some exciting things coming up over the next several weeks. JP Morgan Healthcare event means a lot of interviews with some really significant industry leaders like Microsoft and Roche and Novartis, people from incredible investing firms like Sequoia, Two Bear Capital, are all going to be part of the webinar series in weeks to come. Please stay tuned and hear live from San Francisco. about some of the incredible insights that are going to extend out the conversation that we had today. Take care, everybody.